The shoulder is the most mobile joint in the body. Because it rotates in almost any direction, it is constantly subjected to extreme mechanical strain, making it highly vulnerable to injury and degeneration. When that degeneration leads to chronic pain, patients are often handed a discouraging prognosis, the assumption that invasive surgery is the only real fix. At Harley Street Wellness, we approach this joint differently, offering a clinical alternative that bypasses the traditional surgical pipeline. We are going to walk through a 4-step non-surgical protocol designed to help you reclaim your mobility. Avoiding the operating room requires replacing passive rest with a strictly executed evidence-based medical protocol. Step 1 of this protocol is diagnosing the precise mechanical issue that is restricting your movement. We look for one of 3 primary conditions. The first is a rotator cuff tear. This involves specific structural damage to one or more of the 4 stabilizing tendons that hold the joint in place. The second is frozen shoulder, a condition affecting up to 5.3% of the population. It creates a deep ache and severe stiffness that typically lasts anywhere from 1 to 3 years. The third is shoulder impingement. You can identify this by its main symptom, a sharp pain triggered specifically when you elevate your arm above shoulder height, caused by compressed tendons. Identifying your exact condition is a mandatory first step. Applying a 3-year frozen shoulder recovery timeline to a structural impingement will stall your progress entirely. Step 2 requires looking at the clinical data to weigh the actual risks of surgery against targeted injection therapy. Surgery comes with inherent risks. Across the board, shoulder procedures carry a 10.5% overall complication rate, and surgical recovery often takes 6 to 9 months. Failure rates of rotator cuff repairs show an 11% re-tear rate for small tears, but that rate climbs to 94% for massive tears. A 2024 Mayo Clinic study found advanced injections during repair reduced revision surgeries nearly 3-fold. Even more revealing is a recent blinded, randomized controlled trial looking at shoulder labrum repairs. At the 2-year mark, researchers found 0 clinical difference between actual surgical repair, biceps tenodesis, and a placebo or sham surgery. When the trauma of an operation yields outcomes equivalent to non-invasive therapy in clinical trials, the medical necessity of surgery as a primary intervention for these conditions is called into question. Step 3 focuses on targeted injection therapy to physically alter the environment inside the joint. These targeted injections deliver specific anti-inflammatory properties directly to the affected area. This helps immediately reduce tendon irritation and triggers your body's natural healing mechanisms. A 2023 systematic review published in PMC tracked the effectiveness of these therapies, specifically for patients suffering from frozen shoulder. The data showed that patients receiving targeted injection therapies achieved significantly better range of motion and functional scores compared to those receiving standard steroid injections, with no side effects beyond minor discomfort at the injection site. The injection serves as a physiological reset. By clearing the biological roadblock of inflammation, it opens a window for actual mechanical rehabilitation to succeed. This brings us to step 4, integrating supervised physiotherapy. An injection alone will not permanently fix your shoulder. You have to actively retrain the joint's mechanics. This graph illustrates data from a 2020 randomized controlled trial. It maps a clear divergence. Patients using exercise alone saw limited recovery, while those combining targeted injections with exercise experienced significantly accelerated function and pain reduction. By following this combined approach, the primary milestone you should look for is a distinct, measurable improvement in your shoulder function at the 3-month mark. The injection clears the biological roadblock, but it is the guided 3-month physical therapy that builds the permanent mechanical stability needed to keep you out of the operating room. Restoring function depends on a specific sequence: accurately identifying the mechanical barrier, reviewing the 2024 clinical data, utilizing targeted therapy, and committing to guided rehabilitation. Instead of navigating a 6 to 9 month surgical recovery with a high risk of complications or re-tears, you have a verified, predictable timeline. The protocol is backed by clinical research, but putting it into practice is up to you. A pain-free range of motion is attainable without a scalpel. Contact Harley Street Wellness to begin